Okay, so here's an example of what I was talking about with the disc. What you see here is the disc itself, right between these two bones, is literally crushing or smashing together. This unfortunate little nerve right here is the one that gets compressed, and it will shoot pain wherever your pain may come from. Could shoot it down your leg, down your arm, cause numbness or tingling down your leg or down your arm. These nasty little spikes that start to grow here are called bone spurs. Those bone spurs cause immense amounts of pain and develop over a period of time whenever a problem has been left untreated or undetected. We try and identify those issues because over a period of time it helps us to understand how severe the condition is and how long it's been there. Now, if we allow this degeneration process to continue, this space right here where you see the arrow will continue to smash, and it will try and grow together. If it's allowed to do so, it will result in permanent fusion of the two bones. So therefore you'd have no space left between your bones whatsoever. Unfortunately, that little nerve right there turns red because he's permanently pinched, and at that point in time there's not much that can be done to fix it. We hope to avoid these situations and catch these problems anytime they occur prior to this time, and in doing so we can repair the damage. But that's part of why we take x-rays and MRIs and things of that nature to see if we can fix the problem before it ever gets to this point. Okay, so here's an example of what we call the spinal cord right there. That's the spinal column that protects all the nerves. These yellow little lines here are the actual nerves in the body. You can see your spinal cord runs right down the middle. There's nerves that run down the left hand, the right hand, the left leg, and the right leg. Each of these yellow lines represents a single nerve in the body. Each nerve is protected by a particular bone in the body. When we talk about pinched nerves or decompression as it treats pinched nerves or disc bulges or herniated discs or spinal degeneration or spinal stenosis for that matter, it all affects certain parts of the body. This is the neck area up in here. This is the lower back area, down in here. Each of these bones is going to have a particular function. For instance, this very top one here in red. If we have any problem with that particular bone, it's going to affect the head, the pituitary gland, the inner ears, the nervous system, the eyes, those kind of things. If we drop down a couple down to this one here, which is called C5, that represents the fifth bone in the spine, in the neck area. It would protect the vocal cords, the neck glands, and the pharynx. Also, you can see, though, it causes pain to emanate and radiate down the hands. That's what the little red lines indicate. Go down to the sixth one, and you can see that it causes pain across both shoulders. Here in the red, pain up the back of the neck, and again, more down the arms. Go down another one, and you can see how it starts to affect the hands and elbows. Now, if a person were to have a herniated disc or a bulged disc in the neck area, for the most part, their symptoms are going to be down in the lower arms and hands. It could be numbness, it could be tingling, it could be severe sharp stinging. In the latter stages, it even causes you to lose strength and not be able to hold coffee mugs and things of that nature. You're dropping pencils and so forth and so on. If we move down in here to the lower back, we'll pick the fifth one here. That's that particular bone right there. You can see that if you pinch the nerves or pinch that disc together down there on the fifth bone, your symptoms are going to start from the lower back and go right down the legs. You could have numb feet, numb tingly toes. You could have pain shooting down your legs, down the back of your buttocks, all the way to your feet. Your feet could feel like they're on fire. Some people experience what's called restless leg syndrome. Restless leg syndrome is where the nerves at night are misfiring because of pinches that are occurring down in this part of the body. So if you move down or move up to the third one here, you can see how it would affect the knee area as shown in red. But here's an interesting thing. It also shows the colon and the bladder. A lot of our patients have problems with their colon and bladder at the same time they're experiencing back pain. Well, the reason for that is because the same exact nerves that radiate down the legs and cause your knees to hurt and your feet to hurt are the same ones that make your colon work and make your bladder work. So we actually can treat those conditions by alleviating the symptoms of colon or bladder problems by decompressing or unpinching the nerves of the lower spine. We've had very, very good luck with that, and our patients are extremely happy with that. So this chart is an indication of what part of your body can be affected based on what part of your body is pinching the nerves. Very discreet, very obvious, and pretty much the same on every patient we have. Hopefully we can, with treatment, reduce these symptoms and eliminate the problems, and at the same time correct them so that they don't return. We do that through a combination of neurological treatments, chiropractic treatments, but primarily we do that through decompression treatment, where we would literally alleviate the symptoms by creating space or creating movement down here in this lower spot or up here in the neck region, unpinching the particular nerve right here that's causing the symptoms down the arm, and by doing so we can correct the problem. Now this is an example of how having a straight neck can cause serious problems. This bowling ball represents your head, which weighs about 10 to 14 pounds in the average human being. That cue stick it's standing on represents your neck. Now if that bowling ball or your head weighs approximately 10 pounds, that cue stick being right underneath it would evenly distribute that 10 pounds of weight. In other words, it would spread that weight throughout the entire pole. What it will show you is that if you lean that pole forward, in other words, if you push your head out forward over your shoulders because of bad posture, that 10 pounds grows. It turns into 189 pounds of thrust. Now, if you walk around with your head out over your shoulders and wonder why your neck and shoulders hurt all day long after work, it's because you're having 189 pounds of force on your neck and shoulders, not just the 10 pounds that your head weighs. This bowling ball shows you kind of how much far forward a head can go when it should be back right up in here. When it's forward like that, another thing that happens is that all the weight of this 189 pounds is being placed right on the base of the neck. When that happens, boy, that lower part of the neck starts to deteriorate and degenerate. That leads to arthritis. Now, we don't want to ever have those problems occur, but if we do, we can treat those areas by bringing that head and neck back up over the shoulders and improving the posture. That's how we correct it. Hi, this is Dr. Jeff Smith again. We're here to show you one of our chiropractic treatment rooms. We use 23 different forms of chiropractic treatment in our office, anything from traditional chiropractic to a non-forceful adjustment type technique. So we use a table here. The patients generally lie down on this table. Their doctors can adjust from either side of the table. Some of the things that we do that's a little bit unique, our tables stretch. A lot of our patients enjoy having their back stretched out before the adjustments. And while you're laying down on the table, you will have your back stretched out, and it feels quite good. Again, we do most of our chiropractic work in this office, or this type of office. We have 8 of these different adjusting rooms. This happens to be room number 7. And there we go. Okay, so I'm going to demonstrate the use of our decompression table and how we hook our patients up. This will be a demonstration, obviously, of back pain. So we're going to be working on this patient's lower back. We're also going to demonstrate the use of the oxygen, which is something unique to our clinic and unique to brain-based therapies. Patients, when they're receiving their treatment, are going to be breathing high-volume oxygen to activate the brain, activate the cerebellum, and increase the flow of healing and energy down their body. So in this instance, if we're working on the lower back, by breathing that oxygen in, it's going to heal that area quite a bit more. So let's go ahead and get you just to turn and lie down on your back with your head right up in this area here. Now, if you would, just hold your arms up a little bit, and we're going to put a little strap on. Now, what we do is we put a little strap on the patient here. This kind of holds the body in place. Our machine actually kind of attaches right in this area here to another belt that we have. And the purpose of that is to pull and stretch the body down that direction. So in this case here with a lower back injury, we're going to be stretching the lower back apart, creating room and space for the nerve. Now, the unique thing that we do is we use one of these fancy little devices right here. This is an oxygen generating machine. And what it does is it sends highly oxygenated air into the patient through a little nasal cannula that you get to breathe. What that in turn does is makes your healing effect quite a bit stronger, opens up the brain waves a little bit, activates the brain, makes you feel more clear and think quite a bit better. But the main thing it will do is it will send signals from the brain down the body and heal that lower back as we're stretching it out. So thanks for watching. Hope you enjoyed the video. So this is our therapy suite. As you can see, we can treat many people in this room at the exact same time. We do different things in here, from interferential therapy, ultrasound, laser therapy, roller table massage. We have televisions in the room that help to educate our patients, tell them about certain promotions that we're having and different things like that. We also do exercise in these rooms back here on the end. And one of the things that does is it's rehabilitation, very much like physical therapy. Works very well. This little device over here is our laser machine. We've been using that for quite a while now. Produces wonderful, wonderful results. Most of our treatment is done in this room at the same time under the direction of our two clinic doctors.